Hello, everyone. It's the Empowering New Nurses show. It's time for that. Empowering New Nurses show, and I'm your host, Miriam Smith, DNP. Today, I will continue on that interesting episode, another episode that's of vital importance to our new nurses, to help to alleviate their fears and their anxieties. And as they grow, it will get less. It will be lessened. So today I'll continue. I think about three more tips. The first one I'm going to say at this time is remember to document as you go. You know, we document in the computer. We document as we go. So then there will be less likely any error. But in case of emergency, just remember you should jot down and then immediately after whatever happens to make sure that you document. So it's always important to document as you go to ensure that it is done. Because remember, if it's not written, if it's not documented, it's not done. You know, that's like a rule of thumb. If it's not documented, although you did it, it's not done. So, as you go along, also plan your work for the day. Plan, because honestly, there are some times when, although you plan, things just didn't work. Your patient become very, I would say, what's the word to use at this point? The patient condition deteriorates, and it deteriorates rapidly. You didn't plan for that. You had all your plans. You systematically put how you're gonna work out things. It just didn't work that way, and so forth. You have to prepare for the unknown. Just have a mindset that the changes can occur, but then how you adjust, how you respond to that will make a big difference. Approaching the doctors. It's always important that as you approach your doctor, whatever the patient's condition deteriorates, or there's some labs or any concern that you have that it requires the doctor's attention within a certain time frame, you should be. What you can also do, you have that information. Make sure you have all your information, that you don't have to be, for example, if your labs, or your medication or the vital signs, you make sure you have those information with regards to the call you're going to be making. When you know what you are aware of and you have all that information, whenever you call the doctor, you will be able to give in advance certain information. Now, if you don't, look at a little scenario like this. If you don't have the information, the doctor, say for example, you call the doctor, you don't have the vital signs. It's a condition, it might be, pyrexia or whatever it is, or patient's H&H is low. It's important for you to have the information so that when the doctor asks, you will have that information that's relevant at the same time. So you don't have to be stopping and say, oh, no, not like that. So prepare with your information that you need, that you're going to call the doctor on, so that when he asks question, he or she asks question, you have that information to begin. For example, let's say it this way. This patient is on Lasix, for example, or furosemide. The patient is urinating a lot, and what's in your mind? Is anything coming in your mind as a young nurse? At first you might not thought of it, but as you gain experience, okay, what's the labs like? What's the potassium? What's the electrolytes like? Right? You need to have that ready to give the information, so that the doctor, when responding to you, will be able to say make some orders or so forth, IV potassium or so forth. So you need to have your labs together when you're making those calls. Another example, if you have your patient and heart rate is lower than, for example, digoxin, and the heart rate is lower than 50, is the patient, swollen, whatever it is it what's the rate, what's the rhythm on the strip, stuff like that. What have you seen? Observation, is the patient short of breath? What's happening? What's the pulse like? When you look at the patient's extremities, what is happening? Is the patient breathing normally? So these are information that you would want to have. So in talking to the patient is listening to the doctor. Information you have that will help for the decision making. The doctor come immediately, or the doctor stays a little longer or so. So what you can do to help you along in making those decisions is, because you're new, get second opinion. Ask her. If it's not just obvious looking at you like that, you can ask a nurse or the resources next to you, or ask a nurse or ask the experienced person to get their input, get their insight on it, and then you'll be able to make calls and so forth appropriately. These are some of the tips that I will share with you, and I know you might have others that you want to share also, but it's always important to have information that you're going to translate, information you have that will help the decision making quickly, because you don't want a code to come when it could have been avoided. It's best you rapid response before a code. So it's important to work as a team so that you can get, as the patient's condition is deteriorating, you can get an input from someone else. These are some of the things that will help you to be a prudent nurse, from my opinion. And as you grow, just remember the other person coming behind you. You were there at one point, and this is what it's all about. My experience will help someone else not to make the same mistake. And if there's an error, make sure that it's passed on so that someone else will not make the same mistake. And remember, to err is human. Okay? So long as the care can be given and it doesn't cause the patient, it doesn't affect the patient, it's better it affect you, the person, rather than the patient. But make sure that you do your part in ensuring that the patient gets the best care. These are my tips for you, and I just wish you the best. And just remember, where you are now, if you're 6 months, that's not where you were in your experience 3 months ago. So you will grow. It will get better. And just remember, nursing is one of the careers that you're expected to care for humanity. Be compassionate, be kind, be loving, and share the knowledge you have. Let's be the best nurse ever. Thank you. Miriam Smith, DNP. It was a pleasure to share some of my tips with you, nursing tips, skills, and remember also that there is a nurse who doesn't have the experience as yet and doing skills. You need that little extra help. Ask for help and buddy with someone so that to ensure that you're doing it correctly. Just a little reinforcement to help you along the way, because soon you will have the experience whereby you have to help someone else. That's what it's all about. Nursing is a noble profession. Thank you for listening, and share with me your experiences as a young nurse, as a junior nurse, as a nurse with limited experience at this time. And you will know that you're not the only person. Your case is not isolated. There are many more like you. It's good to share. Thanks for listening. It was a pleasure having you here today. Let's make our nurses, let's help them to grow and to shine in the nursing profession. You can connect with me on Instagram at Podcast Mirror, on Apple at Miriam Smith, on YouTube Miriam Amanda Smith, and Facebook Miriam Smith. Thanks for listening. Go and do great things.